Thank you to all the families who have shared their story with us. Thank you to all the other families that are still fighting this battle. And they might not be on that video, but there's so many families facing this uphill battle. And we just want every single one of you guys to know that you guys are an inspiration to us to keep doing what we're doing. And so we thank you for all of your contributions. We want to send our love to the families who are fighting this battle, and especially the ones who have opened their hearts and shared their stories with us. That's truly, truly a blessing for all of us. And we're sending all our love to you, and we hope that you know that you are never alone. I want to also say that you guys are all amazing who's watching. We actually have $2,000 donated just now from the start of this event, which is amazing. And a special shout out to Shruti for donating $1,000. That's amazing. And thank you so much, you guys. This has been incredible, and hopefully we can keep this momentum rolling. But thank you so much. And now we're going to transition to the next talk of the night from another person that I feel so lucky to call a mentor. Dr. Nick Vitanza is a pediatric neuro-oncologist at Seattle's Children's Hospital and research scientist at the Fred Hutchinson Cancer Research Center. In clinic, he cares for children with central nervous system or CNS tumors, and in the lab, he focuses on understanding the molecular aberrations of diffuse intrinsic pontine glioma and its subsequent vulnerabilities with the hope of improving outcomes for affected children. Please give it up for Dr. Vitanza.
Well, thank you very much, Rachna, and thank you everyone for making time to be here at this event. It's a real privilege to be able to speak with you. I was actually pretty amped up and ready to speak, and then watching the video of those kids, I think Sabina and Mike Prados, who are on this call, so many of those children you recognize, even just their names, from families who email or reach out. And it's incredible that some of those families I've had multiple hour-long conversations with, but actually never seen a picture of their child until just that moment. So just to let you know, the reach that you guys have bringing all these families together is really incredible. But what I'm really tasked with tonight is to tell you a little bit about our work, and more importantly, what your money and what your donations can do, and what is the importance of foundations like this. So I'm a neuro-oncologist and DIPG researcher and run CAR T-cell trials, but most importantly, I was also Mittal's doctor, am Mittal's doctor. I took care of him when I was at Stanford before coming to Seattle. And then I'm very proud to be on the board of the foundation. I want to also thank Sabina for her amazing talk highlighting all the work that she's done, and want to really highlight another thing that this foundation does is it helps link people together so that we're not siloed and independent doing our work. The vision that Drs. Prados and Mueller had back in 2012 and have built on is really a vision of a community of DIPG researchers. And for one thing or another, Sabina and I are probably on a call together once a week or once every other week. We put in for this very large NCI SPORE grant together and have a lot of exciting things coming. But the most important thing is that when we get a result, we'll do the result, and then that afternoon we'll share the information that we got instead of waiting for publications, waiting for things to be shared at conferences. And I think that's how progress is going to happen. The way that progress practically happens for people who are doing DIPG research, by the way, is you can't just go out and write a grant for research. The majority of grants that are funded are grants that you actually have about 50% of the work already completed and actually show in the grant. And you get to call it preliminary data, but what it really is that you've already done most of your work and you're getting people to fund the rest of it. So starting from scratch is almost impossible. Developing DIPG models and things like that are things that you can't get grant funding at all. They want other specific aims, not just building models and doing the prep work for what you want to do. So to get a technician in a DIPG lab to do enough work that can be lead to some important research over a year that would want you to further what you're studying, that's about $50,000 a year to fund that technician. If you find a drug that starts to look good and then you want to put that in a DIPG animal model, that's about another year where you need an animal technician. And that's about $50,000 to fund an animal technician just to dose the drug. Once you've done that, now you have your preliminary data and you can write a grant. So all of that can only happen through philanthropic foundations and through the generosity of people like you. And that's how ideas get advanced. Sabine and I were in rooms a decade ago when people were laughing about vaccines and laughing about CAR T cells. And now we're running those trials because when we couldn't get them NCI funded, we had philanthropic foundations that were helping us get work done. So once you have your preliminary data, once maybe you have a grant and are moving to a clinical trial, well, that grant isn't going to fund the clinical trial. It's going to fund the rest of your lab work. So for developing something like a CAR T cell product, every CAR T cell product we generate costs about $50,000. So just to make that product for a patient. So far in Seattle, we've enrolled 19 patients on our 3 trials. And so you think about, those are all philanthropic dollars that have paid for those children to be able to get their CAR T cells. And the next thing that we're doing through the PNOC Foundation and through the SPORE is we agree with what Sabina was saying, that the single targeting of DIPG is not going to be successful. And we need to bring people who are collaborating and can target opposite things and bring them together for future protocols that are really combinatorial. And so besides the DMG Act, which is very exciting, we're developing an immunotherapy CAR T cell combinatorial trial, and we're doing the beginning legwork for that now with ourselves and CHOP collaborating on that for a future trial that's going to have CAR T cells that target both B7H3 and GD2, the most common things on the surface of DIPG tumor. And the way that we're going to get that done is we're going to have to spend another $50,000 to work out genetic agreements to work through the hospital, and about every year spend $50,000 getting genetic transfer of materials of the CAR T cells from one place to another. And then when we actually have patients who want to come to the trial, to have a patient uproot from where they are and move to a new city, even if the clinical trial is free, costs families on average about $35,000. And that's because they need to find housing, they need to find new food, they need to find new transportation. Often they have to take off work, so their losses are actually much greater than that. So all along this path, from the very first experiment you do in a lab to a patient coming to a site with a clinical trial, there's the background stuff of millions of dollars of infrastructure that big donors and big grants can do. But all along the way, there's these $25,000, $40,000 pieces. And those are huge sums of money, but they're within the realm of foundations like this to be able to generate. And every time a foundation like this gives that amount of money to a researcher, it's an animal technician who's making a discovery. It's a CAR T cell product that's going to be delivered to a patient. It's resources so a family can have housing, take care of the rest of their children while they're getting whatever this investigation agent is. So these dollars really add up. They have a really amazing impact, a really practical impact, an impact that we all feel when we're in the field every day. So you're all doing really good work, and thank you for making time to be with us tonight, and thank you for all of your support.